I washed my hands and donned on all appropriate PPE. I ensured privacy by closing the door or the curtain. And now my name is Angeline and I'm going to be your student nurse. I'm performing a physical assessment. I'm going to verify the patient. Can you state your name and date of birth?
Antoinette Guzman, 9/22/69.
Okay, and do you know where you are?
The hospital.
And do you know why you're here?
For an assessment.
Okay, and can you tell me what year it is?
2020.
And how is your mood today?
Good.
The patient is A&O times 4 and has a pleasant effect. I'm noticing the patient's posture is upright. The patient had an even gait when walking into the exam room. The hygiene is well kept. And I'm going to start by inspecting the head. And I'm noticing that there are no lesions, no scars. I'm just going to palpate, so let me know if you have any tenderness.
No.
Okay, so there's no tenderness. The head is round cephalic and hair is evenly distributed. It is smooth and soft. I'm then going to inspect the patient's face and I'm looking for any bony structures or abnormalities. I'm just gonna remove your glasses. Okay, and I am looking, again, there's no scars or lesions. The color is appropriate to race. I'm gonna ask you a couple questions, okay, to test your cranial nerves. So can you clench your teeth? Can you wrinkle your forehead? Can you clench your eyes shut tight? Smile, and then puff out your cheeks. Can you stick out your tongue? And then move it up and down, and then side to side. Good. Okay, so I'm also now going to ask the patient, you can just lightly close your eyes, and then just let me know when you feel me touching you.
I feel.
Okay.
Feel.
And does it feel equal on both sides?
Yes.
Okay. I'm now going to palpate the sinus region of the patient and just let me know if you have any tenderness.
None.
Tenderness. Sinuses are non-palpable. And now I'm going to begin by examining your eyes. So I'm looking at the eyes and the sclera is clear and white. The iris is blue. I'm noticing that the eyebrows and eyelashes are evenly distributed. They are symmetrical. They are also symmetrical in hair, and there is no protrusion over the eyes. I'm just gonna pull down to check the conjunctiva on both sides. And again, pull down. The conjunctiva is pink and moist, and there is no drainage coming from the eyes as well. I'm now going to do a couple tests to check, and we're first going to start with the extraocular motor. So what I'm going to do is just have you follow my finger, but without moving your head. Okay, and then can you cover your right eye? And now I'm just going to ask you to repeat the numbers.
3, 2, 1.
Okay, and then can you cover your left eye and then repeat the numbers again?
3, 1, 2.
Okay, good. And then now what I'm going to do is have you cover your right eye, and then I want you to look straight at me and then tell me when you see my fingers.
No.
Okay, and again.
No.
And
No.
Okay, now can you cover your left eye? Right, and we're gonna go again.
No. No.
Okay.
No.
Okay, and then with my pen light, I'm going to check the reaction, looking at the other eye as well. Noticing that both eyes are symmetric. The pupils are equal, round, and reactive to light. And now I'm going to move on to the patient's ears. So I'm just going to start by inspecting the ears, making sure that there are no scars or lesions. There are no red streaks that I am seeing, and there is no discharge coming from the ear. I would also take my otoscope and look inside the ear to note the color of the tympanic membrane, which is pearly gray. I'm going to palpate your ears, so just let me know if you have any pain.
Nope, none.
Okay, and then I'm going to palpate for your lymph nodes in front, and I'm going to go behind the ear as well. You have any pain?
None.
Okay, so the lymph nodes are non-palpable and non-tender. I am also going to ask you to close your eyes and then let me know when you hear this sound.
Here.
Okay, and then keep your eyes closed.
Here.
Okay, the whisper test was performed and the patient did hear it, equal bilateral on both sides. Now I'm going to look at the nose of the patient. It is midline as well as the septum is symmetric. I'm going to check the nasal turbulence inside both of the nose, which is not occluded, and I'm also going to test for occlusion by having the patient perform. Can you occlude your right nostril? Breathe in. Okay, and then occlude your left nostril and breathe in. Good. There was no occlusion, and now I'm moving on to the mouth of the patient, which the vermilion border is intact. It is symmetrical. The lips are pink. There's no lesions, no scars around the mouth. The lips are not chapped, they're smooth. What I'm also going to do is ask if you can show me your gums. Really good. Okay. As I asked the patient, I was also inspecting the teeth, which are pearly white. They are aligned and symmetric. They are intact. They're not broken. The gums are pink and moist. I'm now going to assess the tonsils. And can you open up? The patient has no tonsils from a prior tonsillectomy. And I'm going to ask you to say ah.
Ah.
The soft palate rose when the patient said ah. The anterior and posterior pillars were pink. There were no lesions or abnormalities that I noticed in the mouth. Also, the tongue was smooth and moist, and there was no lesions or bleeding coming from the tongue or the gums. Okay, so now I'm going to inspect the patient's neck, and I'm also looking, and there's no predominant pulses. The trachea is midline, and now I'm just going to ask if you can shrug your shoulders, but I'm going to try and push down. Okay, good. And then I'm going to have my hand right here on your head, and can you turn in towards my head? Okay, good. And the other side, turn in towards my head. Awesome. The patient's strength is 5 out of 5. And I'm also going to assess the carotid pulse one side at a time. Okay. Okay, so the carotid pulse is present, equal bilateral, and +2. And now I'm going to inspect the arms. I'm noticing the color that is still appropriate to race. There are no abnormalities. There's no scars or lesions. I'm going to palpate for pain, so let me know if you have any pain.
None.
Okay, and I'm going to palpate for tenderness, or palpate for temperature, which is equal bilateral. I'm also going to palpate for the brachial pulses. They are present, equal bilateral, and +2. I'm going to check for the radial pulse, which is equal, present, bilateral, +2. And then I'm going to palpate for the epitrochlear nodes. Okay, they are non-palpable. And did you have any tenderness?
No, none.
Okay, so now I'm gonna check the strength of the patient for the upper extremities. So can you push your hands out, push them against me? Okay, and then pull my hands towards you. Good, and then squeeze my fingers. Awesome. Strength is 5 out of 5. On both arms, the strength is 5 out of 5. And I'm also going to inspect the hands, again, for any lesions or abnormalities. There is no excess moisture. The nail beds, the contour is flat and smooth. They are evenly distributed. Do you have any tenderness in your hands?
None.
Okay. And I'm also going to check the capillary refill. On both fingers, it is less than 3 seconds, equal bilateral. And now I'm going to test for fingernail clubbing. So can you take your hands and go like this? Okay, and there is no indication of clubbing, which would be chronic hypoxia. So now I'm going to ask if the patient can you turn towards this way, and I'm going to assess the posterior back. Okay. So I am noting the scapular placement, which is symmetrical. The spine is midline, and I'm inspecting the skin. The color is still appropriate. There are no bruises or scars or lesions. And now I'm just going to palpate down your back for tenderness.
None.
Okay, and then I'm going to check the thoracic expansion. Can you take a big deep breath? Okay, thoracic expansion was symmetrical. I'm now going to palpate for tactile phremesis. And can you repeat 99?
99, 99, 99.
Okay, vibrations were felt and they were equal bilateral. I'm now going to listen to some breath sounds. So you can take a deep, big breath with your mouth open every time I move my stethoscope. Okay. Give yourself a hug. I'm going to check the lateral sounds. Breath sounds were clear to auscultation, and now I'm going to assess the anterior chest. Okay, so again, I'm looking at the anterior chest. I don't see any labored breathing, no predominant pulses. The patient doesn't have dyspnea, and the skin color is still appropriate. There are no lesions, bruisings, skin is intact. And before I start, I'm going to assess again for vocal phremesis. Can you say 99?
99, 99.
Okay, vibrations were felt and they were equal bilateral. Now I'm going to listen to some breath sounds again. You can take a deep breath with your mouth open. Okay, good. Now I'm just going to listen to your heart sounds so you can just breathe normally. And I'm going to start with the pulmonic. Okay. Aortic. Erb's point. Okay, tricuspis. Okay, keep set up. And mitral. So the breath sounds were clear to auscultation. The heart sounds, I heard presence of S1 and S2. There's no presence of S3 or S4. There were no presence of any clicks, rubs, or gallops. And now I'm going to ask the patient to lie down, and I'm going to assess the abdomen. Okay. So I'm just going to pull up your shirt. Thank you. So I'm inspecting the abdomen, and I'm noting the color and the contour is flat. There are no predominant bulges or masses that I can see with my eye. There are no scars or lesions, and there is no discoloration. So right now I'm going to listen for bowel sounds in all 4 quadrants. and that was with the diaphragm on my stethoscope. So now I'm going to turn it to the bell and I'm going to assess for any bruise. I'm going to start at the aortic. Listen for the renal on both sides. Okay, and there was no presence of any bruise. Then I'm going to lightly palpate the abdomen, and as I'm lightly palpating, I'm only going about 1 centimeter down on the abdomen. I'm noticing the patient's face for any guarding, and there are no presence of masses or bulges. I would then deeply palpate the abdomen, and I would also palpate the inguinal region for lymph nodes, femoral pulses, and any bulges associated with hernia. Okay, and then you can put your shirt down, and then I'm just going to ask you if you can lift your head. No, just lift your head and test the abdominal strength, which is good. Okay. Now I'm going to move to the lower extremities, and I'm inspecting the legs. Again, noting the color, and I'm also assessing for any vascular deformities which are not present. I'm going to palpate. Let me know if you have any pain.
No. None.
Okay, and I'm going to test the assess the temperature on both legs, which is equal bilateral. I'm going to palpate for pitting edema. Okay. I'm going to test the posterior tibial pulse +2 and present equal bilateral. The dorsalis pedal pulse, which is +2 present equal bilateral. Capillary refill, which is less than 3 seconds. And now before the patient sits up, I'm going to test the lower extremity strength. So if you could just raise your knee and then try and push up this way. Okay, good. And then I'm going to have you sit up and have your legs hang over. Okay, and to finish the strength, I'm going to ask if you can pull your legs in. Good. And then can you give me your feet? And then push down. Okay, good. Push up. Okay. I'm also going to test the deep tendon reflex, which is the Achilles. I'm just going to be like dang over. Okay. And then I'm also going to test the deep tendon reflex on the brachioradialis. Okay. Good. Which is a +2 on both deep tendon reflexes. And now I noticed I was watching the patient when she sat up and she had no difficulty. So now you can stand up. Okay, and then stand over here and walk towards the camera and turn around. Yep, turn around. Walk heel to toe. We're testing the cerebellar function, which is well balanced and intact. And then lastly, we're gonna test the fine motor skill. So you're just gonna have your hand and the opposite hand, and you do this, okay? And then the other hand, and again. Good. And that completes the final assessment.